In this lecture, we will focus on vital signs and shock.
Hello, Namaste. Today we will be discussing vital signs and shock. It is important to understand how to take vital signs because they are used to measure a patient's health status. First responders should also know how to recognize and manage shock, for it is a common condition that occurs in trauma. With that, let's begin.
Shock is defined as the insufficient blood circulation, which results in a lack of oxygen and a lack of nutrients being transported to vital organs. This can lead to organ destruction, coma, and death. Any serious injury or illness can cause shock, but the most common cause is blood loss. This could be from an internal or an external hemorrhage. When we assess our patients, it is important to first determine the mechanism of injury. For example, if we know that a pedestrian has been struck by a vehicle, this greatly increases our suspicion that there may be internal bleeding. Secondly, we want to assess the airway, breathing, and circulation, just as we would with any trauma patient. Third, we will want to transport this patient immediately. This is very important because the patient will require advanced treatment that may only be provided in a hospital setting. And finally, we want to begin any life-saving management during the transportation. To assess breathing, we will measure the number of breaths taken per minute. The way we do this is by counting the number of breaths taken in 15 seconds and multiplying by 4. We do this so that we don't spend an entire minute focusing on breathing rate. The normal respiratory rate is between 14 and 22 breaths per minute. A rapid respiratory rate is between 20 and 30 breaths per minute, and the patient may need oxygen. A very rapid respiratory rate is greater than 30 breaths per minute. This is seen in the late stage of shock, and the patient needs oxygen. Here we see the signs and symptoms of shock. These include altered conscious state, restlessness or irritability, pale or bluish, cool, moist skin, rapid breathing, rapid pulse, and nausea and or vomiting. The first sign of shock is an increased heart rate. For us to assess the circulation, we want to feel for the pulse by pressing 2 fingers on an artery, as shown here. You'll measure the number of beats per minute by feeling the pulse for 15 seconds, counting the number of beats, and multiplying this number by 4, similar to what we did with the breathing rate. There are multiple regions and multiple arteries that we can use to assess the circulation. Just now we showed you a picture of the radial pulse on the wrist being used to assess for the pulse rate. Sometimes in shock, the pulse is very weak in this area, and for that reason we'll use the stronger pulses that are found at the carotid area and the femoral area. However, there are other arteries that you may use to assess for the pulse rate, such as the posterior tibial pulse and the dorsalis pedis pulse. Here we use one of our participants to demonstrate the carotid pulse. You'll see that there is a large muscle, shown here, indicated by the line, that goes from the ear to approximately the mid-sternum region. This is a good reference point because the carotid artery is located just inside this region and below the jawline. Here you see a first responder who is pressing down on this region. It is very important when checking this region that you don't check for both sides at the same time, because that essentially eliminates blood flow to the brain. Here we're demonstrating again the radial pulse on the side of the thumb, the dorsalis pedis pulse, which is on the top of the foot, and the posterior tibial pulse. A normal heart rate is between 60 and 100 beats per minute. Borderline normal is 100 to 120 beats per minute and is seen in early shock. A rapid pulse is 120 to 140 beats per minute and is seen in shock. An extremely rapid pulse is greater than 140 beats per minute. This is a critical condition and the patient may be near death. When assessing our circulation, it is also important to search for any active bleeding or injuries that may indicate an internal hemorrhage. You also want to survey the skin color and temperature, capillary refill time, and level of consciousness. Capillary refill time is taken by pressing down on the nail bed and releasing. You may do this on the index finger. The amount of time that it takes the nail to turn from pale to the natural color, which is pink, is the capillary refill time. What is occurring here is that by pressing down on the nail bed, you're essentially pushing all of the blood out of the capillaries in that area. When you release, you let the normal blood flow bring the blood back into that nail bed and the capillaries within it. With good circulation, this will occur in under 3 seconds. If it takes greater than 3 seconds for the capillary refill, this could be a sign of shock. It is also important to assess your environment. Shock patients frequently have low body temperature, so you'll want to remove that patient from the cold environment, remove any damp clothing from them, and wrap them in a blanket during transportation to keep them warm. Our management of patients with shock includes stopping any active bleeding and preventing any more loss of blood, which would lead to further worsening of their shock, transporting them immediately so they may get the advanced treatment necessary, keeping the patient warm and dry, and ensuring good ventilation and oxygen. As we discussed earlier when defining shock, the patient has an insufficient blood flow and the oxygen and nutrients are not being well transported to the critical organs. If we provide oxygen to the patient, it makes it easier for them to get the oxygen and nutrients to these vital organs. You'll also want to establish IV access and administer fluids. The insufficient circulation could also be the result of insufficient blood volume if it's due to a hemorrhage. So by administering fluids, you increase the volume of their blood circulation to help their critical organs get the adequate nutrients and oxygen that they need. Important points to communicate include the mechanism of injury, the vital signs, airway, breathing, and circulation, the signs of internal hemorrhage and or shock, and the events that occurred during transit. For example, it would be important to know if the patient's symptoms improved after giving fluids. In summary, shock has many causes, but symptoms are usually the same. Rapid transportation to a healthcare center is the most important. Our management of shock includes stopping any active bleeding, transporting the patient immediately, keeping the patient warm and dry, ensuring good ventilation and oxygenation, and establishing IV access and administering fluids.
I hope that the steps in taking vital signs and managing shock are more clear after this presentation. It is now time for you to practice these skills so that you can be better prepared during emergency situations. Thank you. Dhanyavad.